I'll write it down.
You're really moving up.
Thank you, Tina.
Sure.
Before you get to look.
Okay. What's that?
I was just going to say, if you had a moment.
Yes. Yeah, sure. Let me grab
With Tina's.
Okay. She approves me.
You okay? No, you're on the, that's on the next side.
Set up.
Give her a
Oh, absolutely. I completely understand. Oh,
Yep, I'll put it.
and then be a wireless system. Did I? I mean, my blog. I just did an interview. It's been some that's on my sound. Probably get sound. Let me see. Or it might. Let me see.
Okay.
There's a lot of noise.
All of our mental sources in the area to present people as people dangerous community. And we're doing everything in our power to fight it, but we need the community's help, and the only way we're going to do that is through education. So I believe that and teach getting Narcan are fine. forward, it
You know, other things that you can do. I hope,
so if you know somebody or you live with somebody or you know somebody or you're around people a lot who maybe do struggle with an opioid use disorder, trying to people who unfortunately we're hoping by educating the community we can put a dent in some of these steps.
what is
Multifaceted. Is the key in studies. The more people, and it's just do this and none of these who are struggling and resources. Thank you. Was that okay? Okay.
Hey, bud, I was definitely hearing your interview on my wireless signal. Yeah. If you're not getting interference, but if you could change the signal.
yeah.
Okay, I can't get it.
If that happens. I'm not getting the interference on my end, but he'll
So
get
you
it.
heard me good.
Yes.
Nice to meet you. I'm an ER physician for the last 18 years at Lord's. So I got asked this week to do this because I did a KTC interview, and they're like, "Oh, you need to come." I'm like, "When?" No, like Wednesday. I'm like, "Ooh." They didn't give me any time. So, but look, my standpoint is a treatment and what we're seeing. Right? If they ask me those things, I can answer those.
Oh yeah. I've been paramedic for 8 years. So I see it firsthand. Seen a lot of it. Unfortunately. Unfortunately, I've seen a lot of it.
Let me test. Let's test.
Good evening, everyone. Yeah. Good evening, everyone. How you all doing this evening? I'd like to welcome you to this very important event. If everybody could settle down, take your seats, we're going to be beginning the program in approximately 5 minutes. We're going to be beginning in approximately 5 minutes, so if everybody could take their seats and settle down, thank you, and once again, welcome, welcome, welcome for being here. We know that you're going to get some very valuable information for yourself and also to share. So once again, thank you for being here. And we will begin promptly in about 5 minutes. Huh?
fentanyl, maybe from like the police department's perspective, what we're doing, and how important is an event like this?
Of course.
His name's not on the seats. He might be new. I don't know. Talk to Tina.
Jason, Lafayette Police ABMDI, information officer for the police department. This event.
But I just say give it a shot.
Okay. Let me go get the guys over top.
Would everyone take their seats, please? Thank you. Good evening and welcome to the Community Fentanyl awareness event. While in sponsorship with the Louisiana Department of Health, Region 4, and the Lafayette Coroner's Office, will raise the community's awareness of fentanyl, the single deadliest drug, a threat in our nation, in Louisiana, and in Lafayette. Fentanyl is affecting all families, regardless of race, gender, or profession. Our purpose tonight is first, to raise awareness of the danger of this drug and its potency, to present information about signs and symptoms of overdose, to tell you how to respond in case of an overdose, to recommend resources if you are struggling with addiction, and finally, to recommend resources available for treatment, rehabilitation, and counseling by various organizations represented today at the various perimeter tables. I would like to recognize all elected officials with us tonight. Would you please stand? More than 50 partners have joined WOW in this critical community forum. Will all partners stand? Our expert speakers are Dr. Tina Stefanski, Louisiana Department Region 4 Medical Director. Stacy Conrad, where's Stacy? Louisiana Department of Health Region 4 Opioid Prevention Outreach Coordinator. And Keith Talamo, Lafayette Coroner's Chief Medicolegal Investigator. Wow. I will turn the program over to Dr. Stefanski and our expert team and panelists. She will introduce the panelists.
Good evening, and thank you, Ms. Phyllis. So just I first want to start off and acknowledge and thank the ladies of WOW, the Women of Wisdom organization, for bringing us here together. This is really their vision, and they brought us all here, so thank you. And I actually have the easy part tonight, because the panel and the presentation, we've just got wonderful partners and speakers here to share this really extremely important information with y'all. So just a few little points. I also want to acknowledge and thank Mr. Lazard for helping us to find such a great location. This event is also being live streamed on Acadiana Open Channel, which is wonderful. So we really are giving access throughout the community, which is just critically important. And we also have our wonderful partners. So please, if you hadn't already, talk to your partners or our partners in the community at these tables. And one thing that we're really proud of, and it was a collaborative effort, but it's at the Lord's table, is a resource list. So for individuals who do have a substance use disorder and who are looking for linkage to care or treatment resources, we put together, it's a starting point of resources in our community. So please visit the table and get one of those resource lists. So I'll just give you just a real quick overview of how we got here. So last April, Dr. Kenneth Odney and Keith notified lots of us, so lots of these great elected officials who stood in the audience and others in the community, and said, hey, we have a problem in Acadiana, or in Lafayette Parish specifically, but it's really pervasive throughout Acadiana. We're seeing an alarming increase in the number of people dying. So we quickly convened a big community group, hospitals, school systems, law enforcement, the judicial system, just all key players in our community, and everyone was reporting the same thing. We're really seeing an increase, or significant increase, in the number of fatal and non-fatal overdoses. And one of the key messages that came out of that meeting was the need for awareness, and so that's what we're hoping that tonight accomplishes. So there are lots of other things happening in the background, but again, the goal of tonight is to raise awareness, reduce the stigma, help to connect people who are looking for resources in recovery. So thank y'all for being here tonight. So the way this is going to happen, first, Keith and Stacy, they do a tremendous job. You're going to love this presentation. They'll present the information. Following their presentation, you all should have index cards. So if you've got questions for the panel that I'm going to introduce in a second, write them down as you listen to the presentation. At the end, we'll ask if you have a question to raise your hand. Some of the volunteers, we're going to collect those cards, and then we will ask the panel to answer your questions. And so finally, I'll introduce the members of the panel. So we have Dr. Kenneth Odney. He's our Lafayette Parish Coroner. We have Dr. Daniel McNally. Oh, sorry. Yes, deserve a big round of applause, because again, that's how we got here tonight. So just, we owe a big debt of gratitude to Dr. O'Neill and Keith for bringing us here and raising awareness. And the next physician that you have is Dr. James McNally. Dr. McNally works with Ochsner, and he very kindly drove here from Jennings from their family medicine clinic. So he's going to talk to you about substance use disorder and treatment. Next, we have Dr. Mike O'Neill. He's an emergency department physician with Our Lady of Lourdes, and will let us know what we're seeing, these non-fatal overdoses that are also coming through the ERs. We have Mr. Eric Newman. He has been practicing, he's a practicing attorney for 31 years, in criminal defense for 23 years, and he's been the assistant DA for the last 7 years. He's the lead prosecutor for the 15th JDC, and so we're really, again, thrilled to have Mr. Newman, because he's going to offer a perspective that I think is also going to be very eye-opening for all of us. And then last but not least is Blake Miller. Blake is a paramedic, and he works with Acadian Ambulance, or the Acadian companies. He's a quality improvement coordinator and flight paramedic. And Blake's going to also talk to us about Narcan. So that's it. I'm going to turn it over to Stacy and Keith. And again, if you've got questions as we proceed through the presentation, please jot them down on your card. Thank you.
Good evening. Thank you guys so much for having us. I just want to say thank you again to our panel, to all of our community partners. I talk to most of these people daily, and they have been a tremendous help in all of our efforts. This is just one of the many things that we're doing to combat this epidemic of fentanyl, the fentanyl crisis. So I'm going to start. We work real closely with the DEA, and Ann Milligrim is very involved. She's the DEA administrator, and she stated that fentanyl is the single deadliest drug threat our nation has ever encountered. She says that it's taking lives from large metropolitan areas to small rural areas, and we're seeing that. Last year, the DEA seized enough fentanyl to kill every American in the United States. So if that doesn't give you some perspective, just walking in here, I talked to a few police officers and firefighters who are using this stuff almost daily. I know Acadian Ambulance gets calls daily. We hear it. We hear it. The sheriff's office, they've all been instrumental in saving so many lives with Narcan. We'll talk about that in just a minute. So I'm going to tag Keith in. Keith and I do this together. He always says he's the man in the background, but I'm going to tap him in so he can talk to you a little bit about what he's seeing as far as overdose deaths.
All right, great crowd. This is the biggest crowd that we had in the past year for doing this, so thank y'all. We're starting to see, what we've seen in Lafayette, we're seeing the young and old, the rich, the poor, all socioeconomic backgrounds, all races. It's not discriminating. Years ago, we would teach kids, don't do drugs, you can get addicted. Now, me and Stacy going around trying to teach kids and everybody else, don't do it, it's going to kill you. No one ever thinks it's going to happen to you, your kids, or your family until it does. So I just want to encourage everybody, talk to anyone who would listen, because the only way to stop this is communication. I'm going to give our Lafayette Parish numbers. These are all Lafayette Parish deaths. In 2015, Lafayette Parish had 32 overdose deaths, 0 contained fentanyl. 2019, we had 55 overdose deaths, 25 contained fentanyl. 2020, 83 overdose deaths, 50 contained fentanyl. 2021, 137 overdose deaths, 101 contained fentanyl. 2022, 148 overdose deaths, 114 contained fentanyl. I'm waiting for my labs to come back, but as of now, we're up to 30 overdoses. So the average age recently dropped down. It was 25 to 44, dropped down 18 to 44. So our goal is to talk to your kids, talk to anyone. We'll turn it back to Stacy. Thank y'all.
Thanks, Keith. So this is one of the slides that I put it in every presentation because I think it's so important. It shows how many fentanyl pills were seized. These are pills that look like one thing, but they're actually fentanyl. So the drug cartel have been supplying the nation's, pretty much all of the world's supply of fentanyl. There are two main drug cartels, the Sinaloa cartel and the Jalisco New Generation cartel out of Mexico. And this is just one of the many pictures that has been taken by investigators that are investigating, I guess, the DEA. They have agents in 40 different countries investigating the drug cartel. So they're mixing it up in trash cans in filthy conditions. This is a lab that they're creating these fake pills in or these powders in, and they're putting it in everything. I mean, nothing is off limits to these people. They want money and relentless power, and they're going to stop at nothing to get it. If they suffer, if a few fatalities happen along the way, they don't know you, they don't care. So we try to show this to these kids when we go to schools, and we tell them, would you put a sandwich on one of these trash cans and eat it? And they all say, no, that's gross. So it shows you exactly what's happening and where it's coming from. 1,660 pounds of powdered fentanyl may not sound like a lot, but in the hospital, fentanyl is given in micrograms. So micrograms compared to what it's being found in pills, in these fake pills and powders and liquids, they're finding milligrams, and it only takes 2 milligrams to kill somebody. So it takes just a tiny amount. Year-to-date seizures, this was as of last year. This is an older slide, but it just shows you what they're taking off the streets just here in the United States. 20,400,000 fake pills last year. That's a ton. So people at highest risk of fatal overdose with fentanyl and synthetic opioids are those who use drugs such as heroin, counterfeit prescription opioids, or benzodiazepines. Those are the main drugs that have fentanyl in them, like Xanax or Percocet or oxycodone or Adderall, those types of things. And then those who use heroin, it's in street drugs like heroin, cocaine, methamphetamine. The higher potency means their effects are stronger at lower doses than heroin or counterfeit pills they may be mixed in. So when they stop using and then they use again, their tolerance is lowered, but they may want to use the same amount that they used when they stopped, and so their tolerance is lower and they essentially overdose. People using heroin, for people already using heroin, their tolerance to stronger synthetic opioids like fentanyl may be lowered, and their risk of accidental overdose is higher if they unknowingly take fentanyl-laced heroin, whether it's through the same method or trying a new method. Oh, let's see. Okay, so what is an opioid? So prescription opioids, probably everybody in this room has had a prescription opioid. If you have surgery, typically doctors will prescribe an opioid after surgery. It works very well to control pain. Oxycodone, Vicodin, morphine, those are all pain medicines, and those are opioids. Methadone is a drug that is given to, it's a medical, it helps people get off of, people who are on drugs, it helps to wean them off of opioids. And Dr. McNally can talk about that in just a little while. Heroin is an illegal opioid, and 36 people die every day from heroin without fentanyl in it. And then fentanyl, which is a synthetic opioid pain reliever, much more powerful than other opioids. It is approved for treating severe pain in the hospital, but a lot of ER doctors are now telling us that they're seeing more fentanyl in street drugs and people coming in who have overdosed on fentanyl that they have bought on the street versus in the hospital. So this is enough heroin to kill you. It's 50 times stronger. The fentanyl is 50 times stronger than heroin. So this is enough fentanyl to kill you. And then now we're seeing carfentanil. Carfentanil is elephant tranquilizer, and it takes even less than that to kill you. So it's cheap, it's synthetic, so it's easy to make. They don't have to cultivate a plant. So they're just making they're making unlimited supplies for pennies. And selling counterfeit drugs and making a lot more money. And Eric can talk a little bit about how the money transaction works in a little while. So this is just a comparative analog. So carfentanil, fentanyl is 50 to 100 times stronger than morphine. Carfentanil is 10,000 times stronger, which means taking something with carfentanil in it would be like taking 10,000 morphine. So we try to teach, this is what we teach kids, and we just try to explain to them what the dangers are, because about 65% of kids who know the dangers of fentanyl are less likely to use a counterfeit prescription drug or drug at all. So, what does fentanyl look like? Fentanyl can look like anything. Emojis, this is how kids are getting a hold of fentanyl and counterfeit prescription pills. We have been told that by law enforcement that this is happening, and this is happening here. So, you know, just be aware and be on top of your kids. Make sure that you're checking everything that they're doing. And they're getting they're buying them on social media. These are actual social media Snapchats of drugs that were involved in cases, and when these drugs were tested, they were all fentanyl.
So the hello. So what people don't understand, and kids don't understand, it's not even distributed through the pills. This is counterfeit pills, so they can be fentanyl in this section here and none here. So if I take this one and tell someone, oh, this is a good pill, this one right here has a lethal dose. It's not mixed equally.
Yeah, so I kind of call that the chocolate chip cookie effect. So if you get a pill from a doctor and you break it in half and it's a 2 milligram pill, you're going to have 1 milligram on one side and 1 milligram on the other, right? Well, with this stuff, it's inconsistent. You saw the guy, he's stirring it up in trash cans. There's no consistency in these pills. So again, like he said, you might take, if I use the example of a chocolate chip cookie and I take one bite of the chocolate chip cookie, it might have no chocolate chips. So I take a second bite, or if I break it in half, take another bite, it may have all the chocolate chips. And you'll hear from a mom in just a little while whose son took half of a pill and is no longer with us. She's in this room tonight. So this is just an example of a counterfeit oxycodone on the bottom versus a pharmacy grade oxycodone. Lifelong DEA agents cannot tell the difference. There's nobody in this room who can tell the difference unless it's tested. So this is just one example. So we see a lot of polysubstance use. So polysubstance means more than one substance, basically. So if you may have somebody who's using something that's laced with something else, whereas if this person was just using one opioid, it may not affect them. But if they're using multiple substances, it could decrease their respiration so much they just stop breathing. So 2 or more opioids mixed together will have a bigger effect. It'll affect the breathing centers of your brain and slow down or stop your breathing, which is how people essentially die from fentanyl poisoning. 50% in 2019, so this is a little bit old, but 50% of drug overdose deaths involved multiple drugs. And Keith sees that a lot. It used to be just like one drug found in their system, or 2 drugs, and now sometimes there's a couple of pages.
So when we see fentanyl deaths, sometimes we do get straight fentanyl, but for the most part, we get THC, fentanyl mix in our drug screens. We get cocaine, fentanyl mix in our drug screens, methamphetamines mixed in our drug screens. And sometimes, we get family members, who say, hey, they just took a Percocet or he took a Xanax, and, it comes out straight fentanyl.
So pharmaceutical grade fentanyl is fentanyl that is made in a lab by people who have gone to school for decades to learn how to make this stuff. There's quality control, and it's prescribed by physicians who have gone to school for decades, who have learned how to dose this, and then it's given by nurses who have gone to school to learn how to use it. This guy in Mexico he's not doing this because he's a rocket scientist, right? So illicit fentanyl is the black market version of the drug, and it could be made, it may not be the guy in Mexico that's making the pills. It could be that the guy in Mexico shipped the fentanyl to the United States and they're in some rogue lab in a basement somewhere in somebody's house, making this with a pill press to make money.
I was actually remind y'all, if y'all have some questions, write y'all's questions down on the card and then raise your hand and someone will pick it up from you.
Yes. So when batches of fake pills are mixed, again, like we said, it's impossible to tell how much fentanyl is in it or what the exact dosage is. So online pharmacies, because we did talk about online and kids ordering drugs online. So there are safe pharmacies online. A pharmacy online is going to always ask you for a prescription, and it's always going to they're always going to have to verify that prescription. I cannot even get eyeglasses without that prescription being verified by my eye doctor. So if you just order it and they don't ask for any verification, there's a good chance that that's not a legitimate pharmacy. The FDA has, because of all of the fake pills and the fake pharmacies, they do have an Be Safe RX website. If you want to scan the QR code, it'll take you there. I know a lot of people do order their prescriptions 3 to 6 months in advance with online pharmacies. This website can tell you if your pharmacy is a safe pharmacy. So methods of ingestion for fentanyl, it's really any way: orally, inhalation, sniffing, injection, absorption through patches. So we all have heard about fentanyl. If you just touch fentanyl, you're going to overdose and die. So there's not a whole lot of truth to that. Unless you touch your mucous membranes, your eyes, your nose, your mouth, then you may have some problems. But patches are absorbed through the skin, and a lot of times people who are seeking fentanyl will take a patch and put it in their mouth and chew on it, and that they're getting a really high dose when they do that, so they are at risk for overdose. So if you see Louisiana's in the green is the highest. So we used to be in the top 5, and the other states have recently caught up with us. We are not doing great as far as fentanyl goes. So this is death by specific drug, opioid drug used. And as you can see, the synthetic opioids and fentanyl are the yellow and black lines. The other drugs have kind of just remained, they've just kind of remained about the same. So in our region, Region 4, Lafayette is number 1 as far as fentanyl overdose deaths. And you see the graph with the line going up, that's the whole state. But it's Lafayette, Acadia, Iberia, Vermilion, St. Martin, Evangeline, and St. Landry in that order. So this is Region 4 accidental drug deaths by year, and as you can see, it's just steadily going up. The only way we're going to end this is by this. This is the only way that we're going to put a dent in these opioid overdose, in these fentanyl overdose deaths. The DEA says after 5 years, if we do intense education, community education, school education, parent education, teacher education, we can put a dent in 5 years after we lose 500,000 more people. So it's very important to, okay, go ahead.
I just wanted to point out from this slide, so 214 overdose deaths in Acadiana in the year of 2021. That's more than one every other day. So, just again to put these numbers in perspective, these are all people who have loved ones, families and friends. And so I don't want to, I want to make sure that we acknowledge that this is, this is impacting people in this community. And it's, ripple effect, right? It's affecting everyone. So we just want you to understand that these are, these are unfortunately large numbers, and again, so important and so thankful that y'all are here today.
And just to kind of piggyback off of that, these are our community members. These are everybody in Acadiana. I was talking to somebody the other day. Acadiana is so large. I think it was actually Dr. Stefanski. Acadiana is so large, but you can't go anywhere without seeing somebody you know. So, and you probably all have somebody in common. I heard somebody walk in here and talk to one of the moms you're going to hear from in a minute and say, and she said, oh my gosh, my daughter knew your daughter. And she said, oh, it made it so much more real. And that everybody has somebody like that, so it's affecting everybody. The Louisiana Department of Health has on our website, we have a system where you can go in. It's a surveillance system. Anybody can go in and pull data from their area in the entire state. This is the website. It's LDH.la.gov, and you can filter through. You can see your parish, your town. I think you can search by zip code. So it's really a great tool that is helping to educate the community on our own in wherever we live. So I would like to acknowledge, and maybe, are you good coming up? Okay, so I'm gonna show you this quick little 30-second video, and we're gonna talk about somebody by the name of Mitch, and Mitch's sister is here. I'm gonna invite Miss Veronica Arsenault to come up for just a second. Oh, I don't know what happened. What did I do? I think I have to play it from here. Blake, you didn't teach me how to do this.
A bit about my brother Mitch. He was always a happy person. Fentanyl does not impact any particular class, age group, race. On January 20th, 2022, I received a call, and this picture is a picture of him on his obituary. My name is Veronica Williams, and I'm from Lafayette, Louisiana.
This is Mitch's sister, Veronica.
Good evening, everyone. And thank you for being here today. As was said, my name is Veronica Arsenault, and I just wanted to be a part of this, and I have been in contact with the Department of Health and Hospitals just to bring awareness, because I just didn't know at the time how deadly fentanyl was. My brother had a couple of neck surgeries and got hooked on opioids. And on January 20th, 2022, I received a call saying that the coroner's van was in my brother's driveway. Now, no way, you can't spin that any kind of way. There's nothing good about that. So I decided to turn my loss into advocacy, into bringing awareness, because I don't want you to hear what I had to hear. And it happened so quickly. In October, my brother was at a big event, a recognition event, very happy. In November, post-COVID, at my house, we were able to get together as a family, so everybody was happy. He was there. December, 1 month later, he was with his kids at a Christmas event, taking pictures with Santa. We have all the pictures with him, his grandkids, and his children. And then 1 month later, he was on the front of an obituary. That's just how quickly things happen. It takes very little. And think about this, listen, overdose as we knew it, that's not the same definition. It's not that long-term thing anymore. It's not ingesting a handful of pills, injecting an overage of some solution, concoction. It doesn't look like that anymore. I don't smoke, but I guarantee you if I would have got a hold to a pill, I would have the same outcome. So I leave you here today just to say, and remember this, one pill kills. One pill kills. I thank you for hearing me out today, and thank you for being here. It warms my heart that you all are here because that means the word is getting out. Thank you.
When we talk to kids, we get a lot, and the one thing I always stress is communication, communication, communication. Because we all here have problems. I got multiple problems, but no one wants to talk about them. And everybody has someone who cares about them. Everybody has someone who wants to help them. Just talk about it. I mean, that's important. I mean, I had a UL student who just graduated college not too long ago. He broke his leg right before he graduated. You know, he has pins in his leg. He was given medications, but when his leg was better, he was addicted to the medications. He never spoke to someone. So this poor guy went from graduating college to an addiction, because when he had his medication, he went off the street to overdose in a year and a half. So he graduated college, he went to rehab. 2 weeks later after rehab, he died. He died of straight fentanyl. So I just talked to somebody.
So I told you we had a few moms here with us tonight who have lost their children to fentanyl. And I have become very close to all of them in this journey. I did not know how passionate I would be about the job. I used to work in another position with the state, and when I was offered this job, I said yes, not knowing what I was jumping into, and it soon turned into a passion. I live and breathe this job because it's so important to me for these moms. And these are 4 people from our community who have passed away because they took one thing that they thought was a drug that they were buying or taking, and unfortunately their stories ended that day. I want to invite Casey, Denise, and Christy to come up and talk about, and I don't think, is Jean Therez's family here? No? Okay. So they're going to each share a little bit about their experience and their children.
So hi guys, thank you so much for coming. It shows that y'all really want to learn more and want to save more people. We really appreciate. My daughter is Lyric Verrett, 21 years old. 4 days after her 21st birthday, she passed away. 4 months sober, and she got a Xanax. Unfortunately, it was not a Xanax. It was pure fentanyl. Mr. Keith took great care of my daughter, but unfortunately, it was on a slab in the morgue. I do not want you guys to go through this with your children, your brothers, your sisters. Please pay attention when they're giving you all these stats. It's something you don't want to live through, and that's why we're doing this, to save you guys from the heartache, save your kids from dying. It can happen to anybody. It can be in a gummy bear that babysitter Becky took down the street. Carry Narcan. Have Narcan with you. If you need some, they have some here. But it's the one thing in the world that might save somebody. So there's no reason you shouldn't have one in your purse and at your house. You know? You have a fire extinguisher at your house. You really don't think your house is going to catch on fire, but you're protected, right? So make sure you carry Narcan, and please don't ever say, not my kid, because it can be anybody's kid. It does not discriminate, and I just want to let y'all know, please don't say that, and please don't join our club. Talk to your kids. Talk to them how you can trust your best friend. You can trust your best friend all day long, but do you trust the person that they got that Xanax from? Do you trust the person that person got the Xanax from, and the guy that's in the cave making it? You just gotta talk. And thank you guys again so much for coming out. Thank you guys all for helping us share our stories, and we hope it really relates to you guys and makes you more aware than ever. So thank you.
I'm Christy Cavalier, and my son is Hunter Clemens. I lost him February of last year. Hunter knew firsthand about addiction. I'm an addict in recovery, just celebrated 6 years clean. So we do recover. So he is very familiar with what drugs would do to a family. In 2019, he experimented with heroin and suffered an almost near fatal overdose at that time. He woke up after being in ICU for a week, and he went to treatment, and he did everything that he was supposed to do. He moved to Florida, and he was living a great life. He had 2.5 years clean. He had a great job. You know, 2 days before he died, he told me that, I'm gonna come home soon, Mom, I'm gonna be back soon. And I never realized it would be on a plane in a body bag 2 days later. Hunter got a pill from a coworker, a much older coworker that he trusted, and he held onto that pill and debated for a few days whether or not to take it, because like I said, he knew the dangers of fentanyl. So he decided that on Wednesday he was going to take a half of that pill. And he took the half, and he went to work, and he was fine. And so he assumed that that whole entire pill was fine. And he even made the comment to his roommate, it must have not had fentanyl in it, it didn't kill me. Thursday morning, he took the second half, which contained fentanyl, and he was found face down with his lunch still on the floor. I didn't just lose Hunter that day, I also lost a piece of my other 2 children, and my children also lost a piece of their mother. Our kids are supposed to learn from their mistakes, and they're dying from their mistakes. It is in everything. It doesn't discriminate. These kids think that they know better, or they're invincible, or it can't happen to them until it does. You know, I'm super grateful for all the people that have come into my life since that. And, you know, we do amazing things for our kids and to spread their memories. And I just hope if you're suffering with addiction, reach out, call me, like any of us. You know, there's so many people in here in this room too that are in recovery. We'll get you to treatment. You know, you don't have to die from this. In my generation, I was addicted for 20 years, and I was able to get clean. These kids, they don't have a chance to get addicted. They're dying before they're even physically dependent on it. 15, 16-year-olds are going to a party and taking a pill and dying. There's no signs. The parents have no idea what's going on. There isn't any, you know, 20 years ago you had signs that people were using. Today it just takes one time.
Hi, my name is Denise Kono, and Gabrielle Kono was my daughter. Gabrielle was 2 days out of rehab. She was looking forward to going to school, to moving on with her life. And I got a phone call at 8:01 on September 16th. And the lady that owns the sober living house said, Gabrielle overdosed. I said, I'm on my way. The sober living house is 1.5 miles from my house. So I was there and flying in 2 minutes. And I walked in and I saw 2 police officers. And I said, where is she? Let me go see her. And they said, ma'am, you don't want to see her like this. I said, what do you mean? Let me go see my daughter. He said, ma'am, you don't want to see her like this. And that's when it clicked. My daughter was dead. You see, as a mother of an addict, I knew there would be relapses, bumps in the road, but I never thought death. Never crossed my mind. And biggest thing I can tell everybody is, would you wait till your child was in high school to teach them how to cross the road, how to look both ways? You teach them when they're little, as soon as they can understand. The vocabulary might be different, but why wait to educate your kids on drugs till they're in high school? As soon as they can understand, they should know. We no longer live in that time where we can conserve their innocence. Because if we want to keep them alive, we have to teach them. And like Casey said, don't ever say, not my kid. 'Cause I never thought it would happen to me. So Gabrielle was more than just an addict, though. You see, Gabrielle was a soccer player. She lit up a room as soon as you knew she was in that room. You knew because you were laughing. And we will cherish those memories. But that's all we have, are memories. So please, please stay educated. Educate anybody that'll listen. And always, always have Narcan. Thank you.
So we share these stories when we go out into the community and do these presentations, and we will, if there's a phone number and an email address in the live stream, and it's been all over social media, we will do this presentation for any group of 10 or more people. Just email. That email is my email address. If you email me, we will get you booked. We'll go to churches, schools. Anybody who will listen, Keith and I will go out there and do this presentation. It's important, and it's the only way, again, that we are going to put a dent in the fentanyl overdose deaths. So thank you, ladies. If you want to, again, I could not do this. They are such a pivotal part, and you know, we're keeping the memory of their kids alive. Unfortunately, it's in this way, but they have just been so gracious in sharing their children with us in order to save lives. If you want to talk to your children and you just need some conversation starters, this is a good website to go to. It's the DEA and Department of Education. They have a whole booklet that you can either print out or read online about how to talk to your kids about drugs. So at this time, I'm going to turn things over to Blake with Acadian Ambulance, and he's going to talk about what you do if you encounter somebody who maybe has overdosed.
All right, good evening, everyone. Thank you all for being here. Before I get to talking about Narcan, I do want to bring up a couple of things. So one common trend that I've noticed amongst everyone talking up here is communication. It is very important that you talk to your children. I know we've said that a bunch of times tonight, but I cannot stress that enough. Talk to them before you need the Narcan that we're going to talk about here in a minute. Prevention is important. Also, if you have, and we all likely know someone that has struggles with addiction, and we likely know someone that has done an opiate of some sort. Communication with them, even after being addicted and using the drug, is very important. If you chastise them, if you treat them in a demeaning manner, they often relapse much more often. So being compassionate with your children, being compassionate with your family members and friends that you know, and explain to them that you understand that addiction is a disease, and doing that talk with them will help prevent this in the future. So let's talk about Narcan. Narcan is a medication that works primarily on opiates or solely on opiates. So why do we give Narcan? We give Narcan for someone who is not breathing, someone who has slow breathing, or is unconscious. And I want to make something very clear. You cannot harm someone by giving them Narcan. This is not a medication that will cause a significant issue with them. If you give them Narcan and they don't need it, then you just move on. If you don't give Narcan to someone who needs it and their respiratory rate does not come back around, then they die. Narcan is an opioid antagonist. It binds and blocks the receptors, and it may reverse the effects of opioids. So it is very important that you carry it and you have access to it. As we mentioned, there is Narcan here tonight. Carry it in your vehicles. Keep it in your home. Communicate with your children. Communicate with your family where you keep the Narcan in the event that it is needed and you are not there. They must know where that medication is so that they can access it and give it to the person who needs it. Stacy, I'll turn it back over to you. Or you need me for something else? Yes, we can do that. And let's talk about as well, one common question I get when I talk about Narcan is there some legal issue with me giving it, right? So if I take this Narcan right here and I give it to somebody, is there a potential that I could get sued over this, right? So that's called the Good Samaritan Act. The Good Samaritan Act will protect you from being sued for treating someone in good faith. In the event that you are doing it in good faith, as long as you do not take anything in return for doing so, you are protected by the Good Samaritan Act. So this is what the Narcan will look like whenever you take it out of the boxes, the ones that we have here tonight. This is 4 milligrams of Narcan in one of these little containers. There are 2 in the packages, so you have 8 milligrams total, right? People do not have to be breathing for Narcan to work. The Narcan just gets into your mucosal membranes in your nose, and it gets into your system and starts to work for you. So really what you do is you walk up to them, you put the little tip here in their nostril, and you push on the bottom, as I did here. As you do that, it will atomize the medication into their nose and get it into their system. At that point, back up a little bit, give it some time to work, right? Roll them on their side for in the event they start to vomit so their airway is clear, and leave them be. If they do come around and they start getting agitated and want to start fighting a little bit, let them do on their own. Don't go hands-on with them. You will get hurt or you will hurt them. If this does not work within a couple of minutes, like 3-4 minutes, give them another dose. It cannot harm them.
Thank you, Blake. Again, Narcan is available over the counter without a prescription. Louisiana has a standing order which allows you to walk into any pharmacy and request it. And most insurances cover it. Medicaid covers it. There are GoodRx coupons that you can use on it. So it is available. We do have some to give away tonight. If anybody would like some, you can stop by the table afterwards. It's free for us to give you. And again, it will not hurt somebody if you give it to them. So I know our sheriff's department and our police department, with the help of the Acadiana Human Services District and their team, has helped us to get Narcan in the hands of pretty much every firefighter and police officer in Acadiana. And it's helped. We've gotten reports back that there's about a 93% success rate in overdose reversals since they have had Narcan. So thank you to our firemen, wherever they are, our police officers, and all of you who have helped in reversing these overdoses. So there's always going to be something new, right? So one of the newest concerns, and I'll let Keith kind of talk about this too, is xylazine. Xylazine is a horse tranquilizer. On the street, they call it tranq. And it's been found in 58 out of, I'm sorry, what is it? It's 48 out of 48, yes. So it's been found in 48 states. It is here. We are seeing it here in the Acadiana area. It's often mixed with fentanyl and added to illicit opioids. Xylazine and fentanyl mixed together places users at a higher risk for fatal overdoses. The DEA lab system is reporting that in 2022, approximately 23% of fentanyl powder and 7% of fentanyl pills seized by the DEA contained xylazine. So that is an up-and-coming trend. It causes skin lesions that look really bad, almost like a flesh-eating bacteria. It's just always, then there's always going to be something new, which is why this presentation, if you've seen it before, it constantly changes. No two presentations are ever the same, because as we get new information, we try to include it in here and bring it to you guys. So vaping, we talk a lot to the kids about vaping. Their brains are still forming. There are so many chemicals in vapes. We talk about formaldehyde, diacetyl, which you may have heard of popcorn lungs, acrolein, which is used in weed killer. These are all chemicals that are found in vapes. They are harming kids' lungs. There's no long-term data on vapes and vaping. So, we don't know what we're going to see in the future as far as vaping goes. Most kids don't know, believe it or not, that e-cigarettes contain nicotine. So they think that it's just flavoring and it's fun, but they do. They contain nicotine, and it's very addictive. So it harms the part of the brain that controls mood and learning, impulse control. There is a quit line that anybody 13 and above can call. It's 1-800-QUIT-NOW, and they can help with quitting if someone is addicted. Again, 1-800-QUIT-NOW, 13 and above can call it. They don't need a parent's consent. So hopefully they can talk to somebody if they're too scared to talk to their parents. It also increases the risk for future addiction for children who vape. So according to the FDA, nearly 1 in 4 high school students vape. And they're very honest about it when we go to the high schools and ask them, how many of you know somebody who vapes, or how many of you vape? They all raise their hands. Black market cartridges, according to the DEA, can contain fentanyl. So some of these kids are not old enough to purchase a vape legally. And so they're getting them online or from a friend who got them from a friend who got them from a friend who may have gotten them from the guy in the jungle in Mexico. And then vaping can lead to a bronchiolitis that we call popcorn lungs, according to the American Lung Association. That's the diacetyl is used to flavor the vape with all the different flavors. They have peach and cotton candy, and I saw one today, butter pecan. It's very enticing to kids to for that flavor. And I've been around the cotton candy ones, and it makes me crave cotton candy, So it's very enticing for kids. So we talk a little bit about marijuana and high concentrations of marijuana. So the marijuana game is not the same as it was in the 70s and 80s. It's totally different. They're now vaping high concentrations of marijuana. These kids are vaping what is called dab wax out of dab pens. And these kids, and maybe Dr. Odenay can talk a little bit about what he's seeing in the ER, but we're hearing that they're seeing kids come in that look like they may have a traumatic brain injury. They're confused, they're hallucinating, it's causing psychosis. And so I kind of dug into what that would be equal to in comparison to old school marijuana. And I found that 50 Woodstock joints, so 50 marijuana joints from back in the 70s, 80s, and 90s would be equal to one marijuana dab. That's huge. So this is just one picture of what these dab waxes look like. They might call it shatter, crumble, butter. I've heard it called all of these things. And they look like pins. They don't look like a cigarette or vape. They may look like a laser pointer. And they're selling them to kids. They have ATMs in some of these vape shops that kids are being able to use their debit cards, and so it can't be traced back, and they're purchasing it. So it's really scary. It's a very scary time to be a parent, for sure. So 37% of U.S. high school students reported a lifetime use of marijuana, and 22% reported use in the last 30 days. And this is these dab pins. This is what we're seeing in the community. The health risks are increased risk of mental health. It's linked to depression, social anxiety, schizophrenia. It affects the brain. It affects brain function in the part of the brain responsible for memory, learning, attention, decision-making, coordination, emotions, and reaction time. Impaired driving, lung and heart. Your lung and heart is negatively impacted. And potential for addiction. The risk of developing marijuana use disorder is stronger in people who start using marijuana during youth and adolescence. So these are just a couple of the things that are hidden dangers in our community that we see that are sold in vape shops, gas stations. Some of these things you can get in pharmacies. And the scary part about it is none of this stuff is FDA approved. All of this stuff is sold as a dietary supplement. Some of them are like the Sleepwalker. It's a potentiator. So what it does is it increases the effects of alcohol. So if somebody, we heard at a conference that somebody took a shot of this stuff and then drank a half of a margarita and couldn't even stand up. So it's potentiating the effects. It's causing hallucinations. So this is just the deltas or THCs. You have higher risk of seizure activity in using some of this stuff. They're selling this cough suppressant, which is a freebase a medication that people use for coughs, but they're using it at really high doses. I heard one mom say there's no more dangerous place for a kid right now than online. So that kind of hit home. This is a program for parents. It's an 18-minute video where a DEA agent goes through a child's bedroom and shows you all of the hiding places. So I'm not going to play it and bore you with an 18-minute video, but you can watch it on your own time. It's a really good video, and I encourage every parent to look at it. When we do these school presentations, I actually set something up and go through like a child's desk, and people are in shock at all of the different ways that drugs can be hidden. So what can you do? You are all here because obviously you care about your community. So if you go and share this with at least one person, you can make a difference. You might even be able to save a life, because remember, people who know are less likely to use. So familiarize yourself with local resources. Please visit all of our tables and carry Narcan. We have all of our a few resources here, but Lourdes has a whole resource list over there that you can pick up and take with you if you know somebody who needs them, or if you need the resources yourself. And then these are just a few of the sources that we use to make this presentation. So at this time, we're going to take some of our questions, and we're going to have the panel answer. Do y'all have some of your questions ready?
Yeah, no.
Actually, forgot about Dr. McNally. I'm so sorry. I need to have him at all my presentations. So I'm going to get Dr. McNally to talk about some of the treatment options for somebody who does find themselves with an opioid use disorder. Thank you, Dr. McNally.
All right, thanks for having me here. So I've been treating opioid dependence probably for 15 years in Jennings, Louisiana. I saw a need very early on in my patients that I could see were dependent on opioids. Is it on? All right. It's kind of. It's just not very loud. There we go. Oh, yeah, there we go. So, you know, we're talking about fentanyl and deaths and overdoses, and one of the issues is if we can treat dependence on opioids, then we won't have a fentanyl crisis. The reason fentanyl's out there is because there's a large number of people who are dependent on opioids. And I like to use the word dependent, not necessarily, it is an addiction, but addiction carries a lot of connotations and bad stigma. We need to get rid of the stigma of opioids in patients if we're gonna beat this. I'm really happy to see over the last few years that there's this, there's less of like this police force type look into opioids, because even when I started treating opioid dependence, I was closely monitored how many prescriptions I could give of buprenorphine, how many patients I could treat at a time with buprenorphine. I was expected to have my patients do a drug screen every time they came in, and I always felt that that's just policing the patient. If I'm being that way, I'm not going to have the rapport with the patient where they can be honest with me. And so with your family members, I heard somebody say it earlier about, you know, that open communication with your family. Don't chastise them. If you have somebody suffering with this addiction, be very compassionate with them, because if you're at all defensive with them, they're going to not tell you. And if they're not going to tell you, you'll never know. Police force out there, I'm sure there's a lot of people here with the police force. Look, this is nobody wants to overdose. You know, nobody wants to be dependent on opioids. It's just a terrible addiction. I've seen people when they're going through withdrawal in the hospital. It's awful. I mean, it's just the worst feeling in the world. You want, if you are withdrawing from opioids, you want to die at that point. You'll take anything you can to avoid that withdrawal. And so patients who have this addiction, they're going to cheat, they're going to steal, they're going to take from their family, they're going to do whatever they need to do to get to stay out of withdrawal. And I've seen patients who go through $5,000, $10,000 a month of spending their family's savings, you know, just to feed this addiction. And so if we can treat this addiction, we won't need the supply of fentanyl on the street, because there won't be a demand for it. Years ago, the only treatment out there was you go into a rehab facility, you withdraw, you get off of that, you're there for 2 weeks. Some facilities are great, some are terrible. I noticed a couple of people who talked earlier, appreciate y'all talking about your family. I know that's tough. When someone has gone through rehab and gets off of the medication, we see it in two places: rehab facility and incarceration. When you've gone through withdrawal, your tolerance to that opioid comes way down rapidly. So if someone now no longer has the tolerance to something they were taking before, now they get out of rehab, they get out of incarceration, they go back and take something they took before, same safe dose it was. And this, you know, this is even in patients who know what they're taking, back when it was just OxyContin and oxycodone on the street. Well, if your tolerance has come down and you now take the same dose of something you took before, you quit breathing. And so the highest risk person that I see for a death and overdose is shortly after rehabilitation or shortly after incarceration. I read one statistic that said someone who has been incarcerated, their risk of an overdose and death is 100 times that. Not 100%, 100 times the general population of an overdose. And so that tells you how that tolerance has been affected. Methadone has been a treatment for years and years. That came around back, and this is before my time, 60s or 70s, when heroin was a big thing, and they were using methadone to get people off of heroin. Methadone works very, very well. The problem is it's a very controlled substance, also very dangerous. You can overdose on methadone if you take enough. Most methadone clinics, you have to go every day, and you've got to get your dispensing of methadone. So that's very, very difficult, especially in smaller rural communities. There's no methadone clinic in Jennings. They have to drive to Lafayette for that. Buprenorphine became available sometime around maybe 15 years ago. And buprenorphine is a very unique molecule. It's actually an anesthetic used in higher doses in the hospital IV, but as a sublingual medication in low doses, it prevents withdrawal. And it's what's called a partial agonist as well as an antagonist to the mu receptor, which is the opioid receptor in the body. It's very, very safe. The ceiling effect of it, meaning it would be almost impossible to overdose on Suboxone. You could take, 20 times the normal dose that we give patients and they wouldn't overdose. So it's very, very safe. Luckily, the government has finally taken away some of the restrictions of prescribing, so now I'm able to prescribe it to more people. You used to have to take a class. I had to go take an 8-hour class in Baton Rouge to prescribe this 15 years ago. Now physicians can do it online, but most physicians don't know about it and are not using it necessarily. It's a great treatment for people who have opioid dependence. One of the questions I get, and a lot of my colleagues when I first started treating was, well, you're just trading one addiction for another. There's definitely some truth to that. However, if I have somebody on buprenorphine that I treat for years and years and years, their risk of death is almost nothing versus someone who, I may get them off through a rehab facility or something, and then they go back to using. They're at higher risk than had they not used before. What I have seen in my practice over the years is I do have patients. I have some people who've been on it for 15 years and they will never get off. They know what it was like to always trying to be finding their next pill, living that lifestyle, spending all their money. They're very happy on it. They're productive. They're going to work, and they don't want to get off. Most have reduced the dose they started on. But what I generally see is it takes about 6 months for someone on this treatment before the kind of chemistry in the brain resets, where they're kind of back to normal again. And then at that point, they usually start to just want to slowly wean off over time. But it's a wonderful treatment for opioid dependence. The recent statistics I've read on the national level of treating is that people who are on buprenorphine therapy who have a chronic addiction to opioids have a 50% reduction in mortality. 50% reduction in mortality. There's no medication that I give to my diabetic patients, my high blood pressure patients, my cholesterol patients that has a 50% reduction in mortality. It is a really good treatment. I don't know how many places in Lafayette are treating. Unfortunately, there's a lot of places who are just, you had a lot of the, what I call the pill mills. There were a lot in Houston. I don't know about in the Lafayette area if there were, that were just pumping out, 10 years ago, they were pumping out the oxycodone and the MS-Contin, giving people prescriptions. Some of those now have turned to being Suboxone treatment kind of places. Oh, I didn't tell you the names. Other names are Subutex, Suboxone, but the generic name is buprenorphine. Some of those places, they might be charging patients a lot of cash. You got to come in every month, and I don't think that's the best way to do it. The way I treat it in my office is just as regular treatment as I would treat my hypertensive patient, my diabetic patient. You'd walk into my office and you'd never know who the patients who are getting buprenorphine treatment are from anyone else. And if we can get the word out there that there's this treatment available, some of the emergency rooms are starting some programs called a bridge program, which we have in Lake Charles. We're starting in Jennings, and I think Lafayette's talking about doing it in some of the ERs. So, we treat a patient with Narcan, that's great, and you got them to the hospital, and that's great, or Dr. Odney gives them Narcan in the hospital and brings them back, and they wake up and they're okay. They're at a super high risk of death in the next 2 to 3 days because guess what? You gave them Narcan, they came out of withdrawal. they're still in withdrawal the next day. They're hurting, they're throwing up, their abdominal cramps, all of these feelings of withdrawal. If you don't get them treatment right now, they're just going to go back and use something again, and they're at high risk. So we need to treat it, at the base and get people on good therapy. So.
So just one, thank you, Dr. McNally. Quick thing about that is through funding from the Acadiana Area Human Service District, Beacon Community Connections just recently started that navigation program that Dr. McNally talked about. And so we're hoping to expand that to emergency departments throughout the region. So thanks to those, to the district and to Beacon. Dr. O'Neill, do you want to say a few words before we get to questions on the panel? Okay, thank you. We'll just,
Thank you. I'll be brief. How many in the audience have a family member or an acquaintance or someone who's succumbed to death from opioids? It's about right. Unfortunately, the statistics bear out the remainder of y'all in this room. You'll see it in the next 2 years. I don't want to go over a bunch of numbers. Stacy's covered it very well. I'll just tell you, communication, and communication. Talk to your kids, find out who your kids' friends are, but more importantly, find out who the parents of your kids' friends are. You'll be amazed what you'll find out looking at the adults instead of the kids. Look at that. This stuff's everywhere. Stacy pulled up a bunch of pictures. Go in a vape shop, go in a convenience store, and see what's in there, because it's marching into your house, whether you know it or not. You've got to be diligent. Everybody thinks their kid's an angel. If that was the case, there wouldn't be juvenile court. So, stay after them. Talk to other adults. This scares teenagers to death when the parents start talking. You get a lot of information. Talk to their friends, talk to the teachers, and, just stay after it. Why is it important for parents to know their child's password on their phone? Because that's access to everything. And most teenagers handle a phone or a computer better than all the adults in this audience, including me. But, like we say, the golden rule, if you're playing for the phone, you have access to it. I don't care how old they are. But you got to see what's in there, because they'll get it on the internet and order this stuff. And most of us in this room wouldn't know how to do it. They're sophisticated. But anyway, I just talk and stay diligent and talk to the other parents. Thank y'all.
I'm gonna speak for, I guess I speak for Lafayette PD and Sheriff's Department. It's important to have the phone, because I'm speaking for deaths, but we get multiple deaths where you go to the phone, no one knows the password, and you just can't get in the phones. So know your kid's password. Hopefully they make it to the hospital, but it helps start an investigation.
Thank you, Keith. So for anyone else who has questions, please write on your comment card. If you raise your hand, some of these great volunteers will come around and pick up your card and bring it to the front for the panel. So I'm going to start with a couple of questions, and I'll just start with one that's really just like those Valerie and the moms that were here. Another courageous person who has this question, and I'll read it as it's written. I'm 19 years old and lost my brother 8 months ago on July 8th, 2022, to fentanyl overdose. I know grief isn't the same for everyone and has no time limit, but what do you suggest in terms of coping? I'm young and struggle with anxiety and depression as it is, and I'm a little sister who's living a harsh reality. And so I just think that's a very brave young lady who wrote this question. And I would say, another point, awareness, but it's also, we want you to know that this is a community that is really trying to come together to help everyone. And so, we've got a great faith-based community. Those tables in the corner, I would say the faith-based community, Beacon, just has some incredibly caring individuals. The Human Service District, Lourdes has a list of resources at their table. I think if you talk to anyone in this room, that they're going to help help to steer you in the right direction. But again, extraordinarily brave. And I don't know if any of the other panel members have any other suggestions for this young person. But thank you, Judge Edwards, Hospice of Acadiana, and I have to call out Judge Edwards because he knew more about Narcan, and I learned from him a couple years ago when he brought a committee together to try to figure out how can we address this in our community, and then COVID hit, and it was just a whole new world for everyone. But so thank you, Judge Edwards, and Judge Garrett for being here and helping to support these efforts. So then just a few other quick ones, and I'll start with the panel members. What is the maximum amount of Narcan that you can receive? And so, Dr. Michael, now you may want to talk about, I know, we're talking about nasal Narcan in the street, but in the emergency rooms in the hospitals, you're giving it through the IV.
Thank you, Dr. Stefanski. So there's not a top dose, right? The longer acting opiate that you succumb to, the more Narcan you're going to need. Even if they wake up after an overdose, it is critical that they still seek help at that moment. Don't stay home. The half-life of Narcan is very short. If you have 2 doses of 4 milligrams of Narcan, I've given someone 50 milligrams of Narcan in the emergency department through an IV before they finally were able to breathe on their own. We put people on Narcan drips. We mix it in a bag so they're getting maybe 4 to 6 milligrams an hour, and that may go on for 24 hours. If you have someone who decides to crush up some of the other longer acting opiates mixed in with the fentanyl or whatever else that you're taking, this could go on for days. So people are in ICU with an airway for days, and you need to be on a Narcan drip. So there's no top dose, but also don't sit and give the 2nd and 3rd dose waiting while you can be activating Acadian ambulance to come out and provide other resources for you and get you to the emergency department. We manage airways to help breathe for you when the Narcan is not working. A lot of the polypharmacy that Stacy was talking about, it's not just opiates that cause this, right? High doses of benzodiazepines can suppress your respirations, but the Narcan's not necessarily going to work for those. So you have to have Narcan as a tool, but you also are going to need airway interventions and breathing help in order to make it from that. So don't stay home. When someone overdoses and you give them Narcan and they wake up, you need to call and get help. I had another question right here real quick. Can Narcan be given to children in the event if it's unknowingly ingested? Yes. Accidentally, unknowing, on purpose, whatever it is. Narcan is safe in children. It's safe in adults. It's life-saving and definitely safe, and you can use it on your child. And definitely with the child, call 911. Thank you.
So Dr. O'Neill, a little follow-up to that. This question is, when someone goes to the hospital, why do they just let them leave? And I don't know if that's a you or a Mr. Newman question, but.
No, so from an emergency standpoint, what we're dealing with is the emergency aspect of your medical treatment. And this is where bridge programs with Beacon and Dr. McNally and I went to school together a long time ago. And we haven't spoken about this in a while, but it makes so much sense. And he's teaching me tonight. So while I'm an expert on resuscitation and bringing people back from near death with fentanyl and all of the other opiates, I'm learning of how I'm going to be better moving forward, and the community here in Acadiana is going to be better. But we do, so right now we're treating the emergency medical part of that. And when that person becomes stable and they're no longer going to have ill effects from the opiates, we do discharge them. Most want to leave. We cannot hold you against your will, specifically if you didn't try to overdose and kill yourself knowingly, which most of these, large percentage, are not intentional overdoses, right? So they do leave, and we need to be better at providing resources, maybe not into the hospital, but into treatment centers from the emergency department, but we're a far stretch from that right now. with the resources that we have.
Dr. Odenay, somebody asked, is Narcan harmful to children if a child gets it accidentally?
No, not harmful. They can squirt it in their nose. It's going to be safer than them getting a bottle of Tylenol or anything else.
And someone asked what is the expiration window of Narcan? It's usually 3 to 4 years, but you'll see there's an expiration date on the box.
If that's what you have, you use it. If it's expired, there are very, very good studies out there with all medications. And I shouldn't say this as a licensed medical doctor, but the military has done studies where they've buried medicines for 10 years, pulled them up, and looked at efficacy at 10 and 12 years, and it's 95% effective.
And I know we had a couple questions from Mr. Newman. I don't know if you want to address.
The questions I received, which one is a very simple question. Seemingly, it says, why wait to arrest a drug dealer after a death? Why not arrest them now? What is happening is at least locally, the Lafayette Parish Sheriff's Office and the Lafayette Police Department have specific units that are designed to investigate, obtain information, obtain knowledge about drug dealers, the presence of drug dealing, and the ability to obtain drugs through YouTube videos, Facebook, things of that nature seem to be prevalent now. And so what the overworked police officers are attempting to do is not only focus on the street level dealers as well as those who are trafficking through the community, but you now have gangs who are essentially publicizing or romanticizing the use of drugs and guns through YouTube videos, Facebook accounts, Snapchat, things of that nature. So the accessibility for youth and young adults and people of all ages to obtain this information is right on your phone. The efforts being made are tremendous as it relates to arresting and gaining information and getting that information to the prosecutor's office. As it relates to Lafayette Parish, what we have is a track system that specifically divides all criminal offenses either by date of offense or by the fact that a criminal offense may have a drug offense. There are 5 tracks in Lafayette. There is 1 track for drug offenses. We have 3 prosecutors that are focused solely on drug prosecution, either dealers or users, and approximately at this moment we have in the neighborhood of 3,000 to 3,500 cases that are being spread through the 3 prosecutors. The other 4 tracks probably have maybe about the same number. So we're being stretched thin as it relates to trying to prosecute these individuals. But the police officers and the agencies that are tasked with trying to stop the dealers, they're doing an exceptional job. As prosecutors, we're trying to do what we can to get cases to the trial level as fast as possible. So we are attempting to arrest them as soon as we can. The difficulty is getting them prosecuted. Some cases will be in the pipeline from anywhere from a year to 3 years because of the delays caused by COVID, delays caused by just the fact that we have 1 judge that is assigned to essentially prosecute drug cases in Lafayette Parish. I had another question relating to whether or not someone would get into trouble if they call 911 if a friend ODs. There is a Good Samaritan law in Louisiana. I personally had the opportunity to be taught by Judge Edwards about the Good Samaritan law because I was actually prosecuting someone who was involved in a overdose, and the individual was present, and we ended up not prosecuting that individual because of the fact that there is the Good Samaritan law. I also received a question related to what the DEA is doing about the sale of these drugs online. Regretfully, I can't answer that question. My focus is strictly at the state level, but I'm interested now to see what they are or are not doing. I know there was some communication with some federal agents today in court. We speak about education. We speak about having the opportunity to communicate with each other, to communicate with our friends, our family members. That is the most important aspect of why we are here tonight. Judge Edwards was very instrumental in establishing a drug court here in Lafayette and running that drug court to his retirement. And then presently, Judge Garrett is running the drug court. And what we are finding is that the age group for individuals who are coming into drug court is not necessarily the younger individuals. We have individuals who are anywhere from 40 to 50, 60 years old that have been fighting the addiction, fighting the battle for years and years and years, and they are clamoring and begging to get into drug court. When I became the lead prosecutor on the drug track, we had essentially 40 to 45 individuals that were in the drug court program. I checked the statistics today. We are up to 110 to 115 individuals who are presently in drug court, and we are providing them treatment options and treatment opportunities that were present before, but through the use of facilities here in Lafayette, one in particular, we are making a significant difference as it relates to those individuals. We're becoming successful, and we have found that drug court used to be, or to some extent was, the education aspect of drug court. There was this fear of drug court, and what we are doing now, individuals seem to not be as concerned about it from the perspective of punishment. They are understanding that drug court is designed to help assist. We understand that people are going to lapse. We understand that individuals are going to have difficulty, but we're doing a very hard job, but we're becoming very successful at having accomplishments and achievements that I'm proud of. I keep going back to why wait to arrest a drug dealer. I wish that we had more funds and resources, more judges, more police officers. That aspect of it is somewhat frustrating to my end, and so that's why we have, to some extent, at the district attorney's office, switched a lot of our focus to trying to treat individuals through drug court, and more importantly, trying to treat individuals and have persons who are just starting into the drug trade, starting them off in different types of programs through drug court so that they get the opportunity to handle, or at least address their addictions at a much younger age, but convincing individuals who are addicted to drugs that they need to have this type of treatment is a very difficult task from the perspective that no one really understands these individuals and what they're going through as it relates to being prosecuted and being able to get on probation versus going to jail or going to some sort of treatment program. And so the education and the positive aspect of drug court is what we're trying to focus on, and we're becoming a little bit more successful in it.
Thank you very much. And just to kind of also make sure everyone kind of got the point in Stacy and Keith's presentation. So, you know, we know about, you know, the drugs in the community, but also, you know, don't underestimate the access that your kids and your brothers and your sisters and everyone in your life has through accessing and purchasing these drugs online. You know, you can, again, do a lot of research. Snapchat is one that's frequently mentioned, but that these kids are targeted. So they may not be looking for drugs online, but the drug dealers are looking for them. And they look for hashtags and for keywords like depression or anxiety. And then they start to again, target those kids. So if I had a Snapchat account, I probably wouldn't get those ads, right, for these drugs. Or these drug dealers probably wouldn't be targeting me because I might be typing in something that these kids, you know, I would probably be real careful about what I was typing in. But you know, there's stories that within a day or two, kids will be contacted by drug dealers, and these fake pills can be shipped to their house. So again, just don't underestimate the you know, the internet and social media, and make sure, again, you talk to your kids about that.
So I have a question for Dr. McNally. Opioid therapy costs, insurance, Medicaid, cash, estimates, if somebody wants treatment.
That can vary a lot. Medicaid does cover buprenorphine therapy. It may be free or very cheap. It doesn't cost a lot with Medicaid. Most insurances cover it. Buprenorphine went generic a few years ago, so it used to be very, very expensive, and now even cash price patients, most of my patients, I think the most they would pay is maybe $100 a month, which seems like a lot, but when they were spending $5,000 a month to treat their addiction, it's nothing. Also depends on where you're going and seeking treatment. Some of those offices are just cash pay for that. You know, our office that we work in is not. It's just like your normal insurance as a regular doctor visit would be. But that's going to vary depending on who you would see. One other thing I wanted to say, you know, somebody was asking about getting all the drug dealers off the street. Unless you take the demand away, the next drug dealer will just step up. You've got to get rid of demand. I mean, getting more police and getting all the drug dealers off the street won't fix the problem. You have to get rid of the demand for the problem.
So there's another question. Actually, I can probably answer this one. Is there a plan with Lafayette Parish School Board to add the dangers of fentanyl with the students throughout the system? In private schools, charter schools, what grades are you addressing? So Keith and I, along with the University of Louisiana, has been instrumental in helping us. The Department of Nursing, the psychology department, SLIDE is starting to get involved, which stands for student leaders, involved in drinking and drug education. Lauren Robson runs a great program there with her students. So we go out into schools, and yes, there is a plan in place for us to go into Lafayette Parish schools. We do, this is not the presentation we do with them. We do a different presentation that is age appropriate, that teaches them refusal strategies. We teach them what fentanyl is, why it's so dangerous, where it's coming from, and then we put them into situations where they could encounter, because study shows that if they practice those refusal strategies and we help them come up with good excuses, then they're more able to get out of those situations if they are presented with them. So it's been a big hit. Every school we've been to, these students have been extremely inquisitive, extremely honest, observant, and it's really started some great communication, because typically when we talk to the students, we'll go back later that night or the next night and do a parent presentation. And some of our panel members have been panelists at those presentations as well. So yes, we are, if we haven't been in your kids' school yet, There is plans to private and public. We're across 7 parishes, and we're already starting to book into next school year. So grades all the way from 5th all the way up to 12th. So middle and high school. And we absolutely love all the schools, but we do find that middle schoolers are much more inquisitive. They're and it's proven to us that we definitely need to be in some of those younger grades. This would probably be a question for one of you. Our speaker spoke about fentanyl being manufactured in Mexico. Is all fentanyl coming from Mexico?
So, as best I know, the large percentage of the chemicals, can you guys hear? The large percentage of the chemicals are coming from China and being shipped to Mexico. And the manufacturing of the pills for the large percentage of what you see here in the States is actually made in Mexico and brought across the border. And what you need to remember is it's coming in as pills, it's coming in as powder, it's coming in as nasal sprays, it's coming in as eye drops, soaked paper. There is this thing called rainbow fentanyl. It looks like Skittles. So when you're talking to 5th graders and 6th graders and their buddy has some Skittles-looking items, 3 or 4 may not have it, but one's going to kill the kid. And that's just a fact. It's 40% of all pills that come into the United States have a lethal dose of fentanyl in them. Whether that is, my 16-year-old's trying to get an edge on his test, so his buddy has, an Adderall to help him stay awake and focus, right? It's one pill. It's a half a pill that's enough to kill them. And it's enough to kill me or you as an adult. It doesn't have to be a young kid. It's just, none of this stuff is regulated. Fentanyl is a great medicine. I use fentanyl every day in the emergency department. It is a wonderful medicine. I've probably treated some of you guys here and have used it, and it's worked very well. It's got great properties, especially in the elderly, where it doesn't drop your blood pressure. But when it's not regulated and you put just some in a pill, then you're going to end up with, respiratory depression and eventually death from that.
This is for Mr. Newman. What happens in juvenile drug court?
Juvenile drug court is very similar to what we're doing in adult drug court. Again, treatment options, primarily communication between parents, school, resource officers. Juvenile drug court is really just kind of getting up and going, as I understand it. I'm not real familiar with what specific types of programs they have, other than just treatment programs and trying to educate juveniles, to be honest with you.
And work with the juveniles and talk to them. So it's also community-based involvement with the 100 Black Men that joined them. And there's another program that another person in the community is participating with. And what they're facilitating with juvenile drug court is more interactive, not just treatment, plus education. So they're doing a lot more work in the juvenile drug court now than they've used to do in juvenile drug court. So sometimes I sit in for Judge Bro and do juvenile drug court. So it's very interactive, but I commend the 100 Black Men, and there's another program, and I can't think of the name of that program, that's also involved, combined with treatment and keeping up with their education and social services as well.
Yes, and a huge, huge shout out to 100 Black Men. They do so much in our community. They've been a great partner to us. They've been a great partner to the courts. Alton and his team are great. They have really been doing a lot in the community, a lot of mentorship. The next question, for teens who don't use drugs, do they have to worry about coming in contact with fentanyl? Maybe by touching, or if they're at a friend's house, or I'm assuming that's what they mean.
So it's everywhere. We have to assume that. Again, on their skin, no. We've had that talk in the lecture. But the peer pressure, this needs to be, the stigma needs to go away, and this needs to become dinner table talk at every family in Acadiana if you want to move the needle some. It has to be, and I know from the time, and my brother will speak to it, from the time I can remember sitting at the dinner table, my dad talked to us about dope, right? It might have been 10 seconds. It might have been 30 minutes. But by the time you were 18 and left for college, first of all, you hadn't used any, but you were really, really sure about whether you were going to or not. It was like that. We've heard the dope lecture 100,000 times. But I think that as far as the education and the community resources are great, but until we do it at the breakfast table, till we do it at basketball practice, soccer practice, band practice, all the community centers out there, that's how we're going to move the needle. They need to hear this at every place they go, from school to the resource center to practice, back home. It needs to be reiterated, the message, the communication that Keith and Stacy have been talking about. That's how it's going to happen and affect the community, is by everywhere they go, they hear about it. And it's a good discussion, because we're talking, and I was listening to statistics of the 40 and 50-year-olds that have been addicts for 20 years. 5 years from now, you're not going to have addicts from 20 years. These are going to be the death statistics. That's the hard message, is there are no more casual drug users. We all grew up and knew somebody who casually smoked pot in school and casually did some pills. We did. If you don't and you're over 40, you're lying. But there are no more casual drug users now. They might want to be, but the fact is, the way that the drug trade has turned between the tranq that we heard about and the fentanyl and God knows what else, that you cannot be a casual drug user and feel safe. There's just no chance of that. You are literally flipping a coin every time you use it.
And in the parent discussions, that's something that Keith usually brings up about in colleges. Cocaine is very popular, and you know there is fentanyl in cocaine. And so when you talk about people at high risk for overdosing, people who are recreational drug users, right? They don't have a high tolerance. They're using what they think is cocaine. There's actually a very good chance now that cocaine contains fentanyl and can kill that person. So we're talking a lot about one pill can kill, but it's the drug supply is you know, again, pervasive. Fentanyl is pervasive throughout the drug supply.
And people might ask, well, why are they putting fentanyl in Adderall and putting fentanyl in cocaine? Well, because opioids are more addictive. It's one of the most addictive things there is, other than like nicotine. So you start putting this in some other recreational drugs and you get people hooked on that. And now they're on that opioid. And so, but then you have a lot of people who just go out, well, I'm not doing opioids. I'm just doing cocaine. I'm just doing amphetamines. But maybe you're not.
So we had another question, and I think it was already answered, but just to reiterate, if we assist someone with an overdose, will we be arrested, or is this a crime? It is not a crime. Oh, will the person who used be arrested?
Yes, they'll be arrested.
Okay.
And I think that's something we need to talk about as a community. Okay, I might get in trouble here now. So, and I see a good percentage of the African American population here. I'm glad to see that. In my office in Jeff Davis Parish in Jennings, which Jennings is a high population, I can't give the statistics, but it's a high African American population. I bet less than 10% of the patients I'm currently treating with buprenorphine therapy are African American. My nurse is an African American. I trust her. I talk to her about the community all the time and asked her why. Why? I said, this is not just white people who are on opioids. I know that's not true. I said, why do I not have more African Americans who are coming for treatment for this? And she said, because they're scared. They're worried they're going to get put in jail. They're worried their kids are going to get taken away. There's this fear. And so we as a community need to do something about that. we have to find a way to be less punitive on these things, or else we're just going to lose a lot more in that population.
We are not calling the police. No one is calling the police from the emergency department. Okay? You overdose, we're your ally. Our goal is strictly medical.
So this one we get a lot. So is there no concern with fentanyl in touching gas pumps or napkins or a door handle? And we have gotten no reports. I've seen some things on Facebook circulating. The people's name changes 20 times and it happens in 26 different states. We are not getting any reports of that. I don't know if our panel has had any reports of that, but we're not seeing that here. Let's see. Okay, so we got that one. What is dope sickness? Just withdraw.
What about when someone, like when you talk about the marijuana, they use in high concentrations, what does that look like when they come to her?
So pure high concentrations of marijuana, you get cyclical vomiting. We call it cyclical vomiting syndrome. There's few different drugs that will cause that. Marijuana is one. Somebody who smokes marijuana all the time will perpetually just start to vomit. Best ways to cure that is take a hot shower. Hyperemesis, yeah. They scream a lot. I have a couple of friends who do it.
So are you seeing that? What does it look like if a teenager comes in? Have you seen like they don't know where they are? Have you seen?
No, I've had so you're talking about the pens earlier. It reminds me, and I've only been doing this, I only have a 20-year window of drug trade, and I had a good one. I trained in New Orleans, went to school there. It reminds me of PCP when you're talking about the pens, right? They have this rotary nystagmus and they're out of their heads and they're violent. They're violent and they don't know where they are. And if you can calm them down, they wake up and they are the nicest people in the world afterwards. If you can get them to break and get them to sleep and then they wake up, they're fine. But these people don't know what they're getting. That kratom, there are people literally pulling their faces off. Literally their ears trying to rip them off. I've only seen a couple, but I've seen enough talks on it from an emergency medicine standpoint, and it's brutal.
And look, they use it as recreation. It causes brain damage. It's not harmful because it's not a narcotic. It causes irreversible brain damage. And I've seen it. I've had to get kids picked up and put inpatient, and I've seen the after effects 2 years later, non-functional 25-year-olds, and from that.
And I'll say the popcorn lung is going to be from just regular old vaping. I know it's an alternative to smoking, but that's irreversible too. This popcorn lung, it acts like emphysema. We don't have a bunch of data on it, but this is non-compliant airways that create these bubbles. They lose their elasticity. You can't move oxygen in and out, and that is irreversible.
And so when we started going around to the schools, the first presentations, were about fentanyl and overdosing from fentanyl and deaths. But from the first school, they begged us, please talk about vaping. And so y'all need to know that there are kids in this community when it starts in middle school, but certainly in high school that are addicted. They're addicted to vaping. They don't realize that there's nicotine in those vapes. So they're addicted, and there's even more nicotine now than there used to be. So, when Dr. O'Neill's talking about the popcorn lungs, we tell them it's really hard to reach a 15 or 16-year-old and let them understand and help them to understand what they're potentially doing, to their long-term health. So we try to talk to parents, but I think you, parents and grandparents, are going to have the most the most impact on your kids. And we tell them your parents might be vaping too, because they probably don't understand the risks of vaping, because I think a lot of people just don't. So again, please use this as an opportunity to start that conversation.
So we have time for one more question because we want to get you guys to be able to go around and grab some Narcan before we get kicked out of this great place. Are there programs in Lafayette that train and encourage student organizations about drugs to become peer leaders in combating drug use for our young people? And yes, the University of Louisiana Lafayette has recently started SLIDE, which I talked about earlier, student leaders educated in student educators informed in drinking and drug education, and they are a great organization if you're a student at UL, or just if you're a young person who needs some encouragement or somebody to talk to. I've worked with these guys. They're great. So y'all visit their table, and good job to UL. Thank you to all of our community partners. Do y'all have anything?
There was a question asked as to whether or not our office has used Millie's Law to prosecute anyone that has killed someone with fentanyl. Millie's Law is a law that was passed in the legislative session during 2022 that specifically changed the offense as it relates to the distribution of fentanyl, and it specifically states that if a distributor of fentanyl causes serious bodily injury, then that offense can be classified as a crime of violence, and a crime of violence, any individual that is prosecuted and convicted for a crime of violence, the length of time of the sentence that they serve is significantly more. Presently, we have 2 cases in Lafayette Parish that are being prosecuted under Millie's Law.
Thank you. So we just have 2 questions that we weren't able to get to, so I don't want to ignore anyone's question. What are some uncommon causes of addiction? So I would say come in, and you can either talk to us at the LDH table, the Acadiana Area Human Service District, Beacon, and we could maybe talk to you, talk a little bit about addiction. And then, is fentanyl just mixed with ketamine, or is it a different method of production? I don't know, but if anyone has questions, you can call or email us, tomorrow, this week, and we'll help to get some of these questions answered. Okay. Oh, look, donate.
Carfentanyl is just a separate, it's a separate molecule from fentanyl. It's much stronger than fentanyl. Transdermally, that could lead to death. Theoretically, just by the 1,000 times more potent, carfentanyl could. We have not seen that in Acadiana, as best I know, but it's a different molecule and synthetic.
Well, thank you all very much.
Thank y'all.